My project proposal is increasing usage of the StartBack screening tool to improve stratification of care for patients with low back pain in MSK practice. My aims are to increase the usage of the StartBack screening tool in patients with lower back pain in the MSK clinic at Parkhead Hub to 80% in 12 weeks, to increase the mean change by at least 12.88 in the ODI from first appointment to discharge in patients managed by stratified care in 12 weeks, and to observe a greater mean change in the ODI from first appointment to discharge in patients who are managed by stratified care versus those who are not in 12 weeks. So the StartBack screening tool is a 9-item tool that screens for psychosocial factors and stratifies patients based on their score. It is endorsed by NICE guidelines and currently in place in NHS Greater Glasgow and Clyde. This is what the tool looks like. Why is there a need for service improvement? Lower back pain is very common. In Glasgow in 2016, there was over 100,000 cases, and up to 60% of adults experience it in their lifetime. Psychosocial factors are a large aspect of lower back pain. Staff knowledge, beliefs, and engagement act as barriers to action when using the StartBack tool. This means that patients don't experience the full benefits of stratified care, and this indicates that there needs to be changes to clinical behaviour. So I was on placement at Parkhead Hub, and I encountered many patients with lower back pain that were influenced by psychosocial factors. The StartBack forms were available, and there was a tick box in the subjective assessment for StartBack. Despite this, I didn't see the tool being used, which means that patients weren't being effectively stratified. And we know there's lots of benefits to stratified care, such as reducing pain, improving work-related outcomes, and reducing costs compared to regular physiotherapy. Parkhead missed out on these benefits due to low StartBack usage and subsequent poor stratification. Therefore, there is a need for service improvement to increase StartBack screening tool usage and improve care stratification. My intervention is creating a StartBack guide and delivering a brief refresher session led by the senior physio. This will work by educating staff and showing them the evidence base and rationale behind StartBack and stratification, which will motivate them to better use the tool and improve stratification of care. This is what the guide would look like. My primary project proposal outcome is to improve patient function and reduce disability. This will be measured by the Owestry Disability Index. My secondary outcomes are to improve patient flow and improve staff experience and satisfaction. Patient flow will be measured by measuring discharge rates for low-risk patients and measuring did not attend rates for all lower back pain patients. Staff experience and satisfaction will be measured by Likert scale taken every 4 weeks, and we will also collect qualitative data every 4 weeks during the staff meetings. This slide shows the key stakeholders, the role that they will play in supporting the project, and the benefits that they can experience as a result. Some of the staff might be apprehensive about the service change because it requires a lot of buy-in. This will be addressed by showing the benefits of StartBack and stratified care, which is supported by a large body of evidence. Additionally, monthly check-ins and Likert scale data will allow staff to provide feedback and share their experiences. Patients might lack motivation to fill out the forms or not have the time, and this will be addressed by the receptionist giving the forms to the patients at reception and encouraging them to fill them out. My QI tool is the PDSA cycle. It is a 4-step iterative model that is the most used tool for healthcare improvement. PDSAs build fundamental knowledge, assist in learning, and encourage evidence-driven changes. When PDSAs are done correctly, there are significant improvements in patient outcomes and care. This is what my PDSA cycle would look like. The plan section consists of my aim, hypotheses, and explains how the project will be carried out week by week. In the do phase, the MDT will perform the plan whilst documenting information throughout. In the study phase, data will be collected and analysed. And in the act phase, the MDT will adopt, adapt, or abandon different aspects of the project based on the findings. We will then start another PDSA cycle. And these are my references. Thank you for listening.